The 5 most vital organs of the human body: heart, brain, kidneys, liver, lungs.
Fascinating facts about 5 most important organs in your body.
The heart, the lifeline of the body. It serves as the very essence of life, pumping oxygen-rich blood throughout our bodies, sustaining our existence. Often referred to as the engine of the circulatory system, the heart plays a crucial role in maintaining our overall health and vitality. We will delve into the intricate workings of the heart, its anatomy, function, common ailments, and the importance of maintaining heart health. Anatomy of the heart. The heart is a muscular organ situated between the lungs and the thoracic cavity. It is roughly the size of a human fist and weighs about 250–350 grams in adults. The heart is primarily composed of 4 chambers, 2 atria, upper chambers, and 2 ventricles, lower chambers. Let's explore its structure in more detail. 1. Atria. The right atrium receives deoxygenated blood from the body's veins and pumps it into the right ventricle, while the left atrium receives oxygenated blood from the lungs and sends it to the left ventricle. 2. Ventricles. The right ventricle pumps deoxygenated blood to the lungs for oxygenation, while the left ventricle propels oxygen-rich blood throughout the body via the aorta. 3. Valves. The heart has 4 valves that regulate blood flow. The atrioventricular valves, consisting of the tricuspid valve on the right side and the bicuspid or mitral valve on the left side, prevent backflow of blood from the ventricles to the atria. The semilunar valves, including the aortic and pulmonary valves, prevent blood from flowing back into the ventricles from the arteries. 4. Coronary arteries. These arteries supply the heart muscle with oxygen and nutrients, ensuring its proper function. Function of the heart. The heart's primary function is to pump blood throughout the body, delivering essential oxygen and nutrients to cells while removing waste products like carbon dioxide. This process is achieved through a complex sequence of events, known as the cardiac cycle. Common heart ailments. The heart is a remarkably resilient organ, but it is not immune to disease or malfunction. Several common heart ailments can impact its function and overall health. 1. Coronary artery disease, CAD. This condition occurs when cholesterol deposits, plaques, build up in the coronary arteries, narrowing or blocking blood flow to the heart muscle. CAD can lead to chest pain, angina, or heart attacks, myocardial infarctions. 2. Heart failure. Heart failure happens when the heart is unable to pump blood efficiently, often due to weakened heart muscle or damage from other diseases. Symptoms include fatigue, shortness of breath, and fluid retention. 3. Arrhythmias. Arrhythmias are irregular heart rhythms, which can lead to palpitations, dizziness, or even cardiac arrest. They can occur due to various factors, including electrical abnormalities, heart disease, or medication side effects. 4. Valve disease. Problems with heart valves can cause regurgitation, leaking, or stenosis, narrowing. Valve issues may be congenital or result from infections, aging, or other heart conditions. 5. Hypertension. Persistent high blood pressure can strain the heart, potentially leading to heart disease, stroke, or heart failure. Preventing heart disease. Maintaining heart health is crucial for a long and healthy life. Here are some essential steps to prevent heart disease. 1. Healthy diet. Consume a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Limit saturated fats, trans fats, salt, and added sugars. 2. Regular exercise. Engage in physical activity regularly. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. 3. Maintain a healthy weight. Achieve and maintain a healthy weight to reduce the risk of heart disease. 4. Manage stress. Practice stress reduction techniques like meditation or deep breathing to lower stress levels. 5. Avoid smoking. Smoking is a major risk factor for heart disease. Quitting smoking significantly improves heart health. 6. Limit alcohol. Limit alcohol consumption to moderate levels or avoid it altogether. 7. Regular checkups. Visit your healthcare provider for regular checkups to monitor blood pressure, cholesterol levels, and overall heart health. The brain. The command center of human existence. The brain, often hailed as the most complex organ, serves as the control center for our entire existence, orchestrating our thoughts, emotions, movements, and bodily functions. We will explore the intricacies of the brain, including its anatomy, functions, cognitive processes, and the importance of brain health. Anatomy of the brain. The human brain is a soft, jelly-like organ that weighs approximately 3 pounds, 1.4 kilograms, and is composed of about 86 billion nerve cells called neurons. It is encased within the protective confines of the skull. The brain can be divided into several key regions, each responsible for specific functions. 1. Cerebrum. The largest part of the brain, the cerebrum, is divided into 2 hemispheres, right and left, and is responsible for higher cognitive functions such as thinking, reasoning, memory, and voluntary muscle control. 2. Cerebellum. Located at the back of the brain, the cerebellum plays a crucial role in coordinating motor movements, balance, and posture. 3. Brainstem. The brainstem connects the brain to the spinal cord and controls vital functions such as breathing, heart rate, and basic reflexes. 4. Limbic system. This complex network of structures deep within the brain regulates emotions, memory, and certain aspects of motivation. 5. Basal ganglia. These structures are involved in motor control, learning, and habit formation. Functions of the brain. The brain is responsible for an astounding array of functions that make us who we are. 1. Consciousness. The brain gives rise to consciousness, enabling us to perceive the world, think, feel, and make decisions. 2. Cognitive functions. These include memory, attention, problem-solving, language, and executive functions like planning and decision-making. 3. Motor control. The brain coordinates voluntary and involuntary muscle movements, allowing us to walk, talk, eat, and perform countless other actions. 4. Sensory processing. The brain receives, interprets, and integrates information from our senses, enabling us to experience the world around us. 5. Emotion regulation. The brain's limbic system plays a pivotal role in experiencing and regulating emotions. 6. Autonomic functions. The brainstem controls vital autonomic functions such as heart rate, breathing, and digestion. Common brain diseases. 1. Alzheimer's disease. Alzheimer's is a progressive neurodegenerative disorder characterized by memory loss, cognitive decline, and behavioral changes. It is the most common cause of dementia. Solution. While there is no cure for Alzheimer's disease, early diagnosis and management can help slow its progression. Medications and lifestyle interventions may provide some relief of symptoms. 2. Stroke. A stroke occurs when the blood supply to the brain is interrupted, leading to brain cell damage. Symptoms include sudden numbness, confusion, trouble speaking, or severe headaches. Solution. Immediate medical attention is crucial during a stroke. Treatments include clot-busting drugs and surgery to remove clots or repair blood vessels. Rehabilitation therapy helps patients regain lost functions. 3. Parkinson's disease. Parkinson's is a progressive movement disorder that affects motor skills. It can cause tremors, rigidity, and difficulty with balance and coordination. Solution. Medications, physical therapy, and in some cases, Deep brain stimulation surgery can help manage the symptoms of Parkinson's disease. 4. Epilepsy. Epilepsy is a neurological disorder characterized by recurrent seizures, which can vary in intensity and type. Solution. Anti-epileptic medications are often used to control seizures. In some cases, surgery may be recommended to remove the seizure focus in the brain. 5. Brain tumors. Brain tumors can be benign or malignant and can develop in various parts of the brain. Symptoms depend on the tumor's location and size. Solution. Treatment options include surgery, radiation therapy, chemotherapy, or a combination of these, depending on the type and stage of the tumor. Maintaining brain health. Maintaining brain health is vital for a high quality of life and cognitive function throughout one's lifespan. Here are some essential tips for promoting brain health. 1. Balanced diet. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Omega-3 fatty acids found in fish are particularly beneficial for brain health. 2. Regular exercise. Physical activity improves blood flow to the brain and supports cognitive function. 3. Mental stimulation. Engage in activities that challenge your brain, such as puzzles, reading, learning a new skill, or playing musical instruments. 4. Sleep. Get adequate, quality sleep to promote memory consolidation and overall brain health. 5. Stress management. Chronic stress can be detrimental to the brain. Practice relaxation techniques like meditation and deep breathing. 6. Social engagement. Stay socially active to maintain cognitive health and emotional well-being. 7. Avoid harmful habits. Limit alcohol consumption. Avoid smoking and protect your head from injury to reduce the risk of brain damage. The kidneys. The kidneys are two bean-shaped organs, each roughly the size of a fist, located on either side of the spine, deep within the lower back. Often referred to as the body's filtration system, these remarkable organs play a pivotal role in maintaining overall health. We will discuss workings of the kidneys, their anatomy, functions, common disorders, and the significance of kidney health. Anatomy of the kidneys. The kidneys are highly complex organs composed of various structures, each with specific functions. 1. Renal cortex, the outermost layer of the kidney where blood filtration begins. 2. Renal medulla, the inner part of the kidney consisting of renal pyramids that contain nephrons. 3. Nephrons, the functional units of the kidneys, responsible for filtering blood, reabsorbing essential substances, and eliminating waste products. 4. Renal pelvis, the central collecting area where urine from nephrons is collected and funneled into the ureter. 5. Ureters, tubes that carry urine from the kidneys to the bladder. 6. Bladder, a storage organ for urine until it is expelled from the body through the urethra. Functions of the kidneys. 1. Filtration. The primary function of the kidneys is to filter waste products, excess ions, and toxins from the blood to form urine. This process occurs in the nephrons within the renal cortex. 2. Regulation of blood pressure. The kidneys play a pivotal role in controlling blood pressure by adjusting the volume of blood and the concentration of sodium and other electrolytes in the body. 4. Acid-base balance. The kidneys regulate the body's pH by excreting hydrogen ions and reabsorbing bicarbonate ions. 5. Erythropoiesis regulation. They produce and release erythropoietin, a hormone that stimulates the bone marrow to produce red blood cells when oxygen levels are low. 6. Waste elimination. The kidneys remove metabolic waste products, including urea and creatinine, from the body through urine. 7. Red blood cell production. The kidneys play a key role in producing red blood cells, ensuring the body receives an adequate supply of oxygen. Common kidney diseases. 1. Chronic kidney disease, CKD. ED is a progressive condition where the kidneys gradually lose their function over time. It can be caused by diabetes, high blood pressure, and other factors. Solution. Treatment focuses on slowing the progression, managing underlying conditions, and making lifestyle changes. In severe cases, kidney transplant or dialysis may be necessary. 2. Kidney stones. Kidney stones are solid mineral deposits that can form in the kidneys and cause severe pain when passing through the urinary tract. Solution. Treatment depends on the size and location of the stone. Options include pain relief, medication, or procedures to remove or break up large stones. 3. Urinary tract infections, UTIs. UTIs can affect the kidneys and cause symptoms such as fever, flank pain, and frequent urination. Solution. UTIs are typically treated with antibiotics, and prevention involves good hygiene and adequate fluid intake. 4. Polycystic kidney disease, PKD. PKD is a genetic disorder characterized by the growth of cysts in the kidneys, leading to kidney enlargement and impaired function. Solution. Management includes symptom relief, blood pressure control, and addressing complications. In some cases, kidney transplantation may be necessary. 5. Glomerulonephritis. Glomerulonephritis is inflammation of the kidney's filtering units, glomeruli, and can result from infections or autoimmune diseases. Solution. Treatment focuses on addressing the underlying cause and may include medications to reduce inflammation and manage symptoms. The kidneys, often underestimated in their importance, are vital organs that play a central role in maintaining overall health and homeostasis. The liver. The body's multifunctional powerhouse. The liver, one of the body's largest and most versatile organs, is often described as the body's chemical factory. Located in the upper right quadrant of the abdomen, the liver performs a wide range of essential functions that are vital for maintaining overall health and well-being. We will explore the intricate workings of the liver, its anatomy, functions, common disorders, and the importance of liver health. Anatomy of the liver. The liver is a reddish-brown organ that weighs roughly 3 pounds, 1.4 kilograms. In adults, it is divided into several lobes, with the right lobe being the largest. The liver is comprised of numerous microscopic units, called hepatocytes, which are responsible for carrying out the organ's functions. The liver structure includes 1. Lobules. The liver is organized into lobules, each consisting of hepatocytes arranged in hexagonal patterns around a central vein. 2. Hepatic portal system. The liver receives blood from 2 sources: the hepatic artery, which carries oxygenated blood, and the portal vein, which transports nutrient-rich blood from the digestive organs. 3. Bile ducts. The liver produces bile, which is transported through a network of bile ducts and stored in the gallbladder. Bile aids in digestion by emulsifying fats. Functions of the liver. The liver carries out a myriad of critical functions that are indispensable to maintaining homeostasis and overall health. 1. Metabolism. The liver regulates the metabolism of carbohydrates, fats, and proteins. It stores glucose as glycogen and converts it back to glucose when needed for energy. 2. Detoxification. The liver filters and neutralizes toxins, drugs, and metabolic waste products from the bloodstream. 3. Protein synthesis. The liver produces important proteins, including albumin, which helps maintain blood volume and pressure, and clotting factors, which aid in blood coagulation. 4. Bile production. The liver synthesizes bile, which is essential for the digestion and absorption of fats in the small intestine. 5. Storage. The liver stores important nutrients such as vitamins A, D, E, and K, iron, and glycogen for future use. 6. Immune function. The liver contains immune cells that help defend against infections and toxins. 7. Blood regulation. It regulates blood volume and pressure by controlling the release of blood into the circulation. Common liver disorders. The liver is susceptible to various disorders and diseases, which can impact its function and overall health. Some common liver-related conditions include 1. Hepatitis. Inflammation of the liver, often caused by viral infections. Examples: hepatitis A, B, or C, and excessive alcohol consumption. 2. Fatty liver disease. A condition characterized by the accumulation of fat in the liver, often associated with obesity and metabolic syndrome. 3. Cirrhosis. A late-stage scarring of the liver tissue caused by long-term liver damage, commonly due to alcohol abuse or chronic viral hepatitis. 4. Liver cancer. Primary liver cancer, hepatocellular carcinoma, and metastatic liver cancer can originate in the liver or spread to it from other parts of the body. 5. Jaundice. A yellowing of the skin and eyes caused by the buildup of bilirubin in the blood, often due to liver dysfunction. 6. Liver failure. Acute or chronic liver failure can occur when the liver is severely damaged and can no longer perform its essential functions. Importance of liver health. Maintaining liver health is crucial for overall well-being. A healthy liver. 1. Supports digestion. Proper bile production and secretion are essential for digesting and absorbing fats and fat-soluble vitamins. 2. Aids detoxification. The liver plays a central role in detoxifying the body, removing harmful substances and metabolizing drugs. 3. Maintains metabolic balance. The liver regulates blood glucose levels, aiding in energy balance and preventing conditions like diabetes. 4. Ensures proper blood clotting. The liver produces clotting factors necessary for wound healing and preventing excessive bleeding. 5. Supports immune function. It helps protect the body against infections by filtering and destroying bacteria and other pathogens. The liver, a multifunctional powerhouse, is indispensable to the body's overall health and well-being. Understanding its anatomy, functions, common disorders, and the importance of liver health empowers individuals to make informed choices and take proactive steps to protect and nurture this vital organ. The lungs, the breathing engine of life. The lungs are an essential part of the human respiratory system, enabling the exchange of oxygen and carbon dioxide, a process vital for sustaining life. Located within the chest cavity, these two spongy organs play a crucial role in providing the body with oxygen while removing waste gases. We will delve into the workings of the lungs, their anatomy, functions, common disorders, and the significance of lung health. Anatomy of the lungs. The human lungs are paired organs, each divided into sections known as lobes. There are 2 lungs, the right lung with 3 lobes, upper, middle, and lower, and the left lung with 2 lobes, upper and lower. The lungs are further divided into smaller units called lobules, which contain clusters of air sacs known as alveoli. The lung structure includes 1. Trachea. The trachea, or windpipe, is a tubular structure that connects the throat to the lungs, allowing air to flow in and out. 2. Bronchi. The trachea branches into 2 bronchi, one for each lung, which further divide into smaller bronchioles. 3. Alveoli. At the end of bronchioles are tiny air sacs called alveoli. These are the primary sites of gas exchange, where oxygen enters the bloodstream and carbon dioxide is removed. 4. Pleura. The lungs are surrounded by a double-layered membrane called the pleura, which helps protect and cushion them, while allowing for smooth movement during breathing. Functions of the lungs. The primary function of the lungs is to facilitate respiration, the process of exchanging oxygen and carbon dioxide with the external environment. This critical process serves several key functions. 1. Oxygenation. The lungs absorb oxygen from inhaled air and transfer it to the bloodstream, where it binds to hemoglobin and red blood cells for distribution throughout the body. 2. Gas exchange. In the alveoli, oxygen diffuses into the bloodstream, while carbon dioxide, a waste product of metabolism, diffuses out of the blood and into the alveoli to be exhaled. 3. Regulation. By controlling carbon dioxide levels, the lungs help regulate the body's pH balance, preventing it from becoming too acidic or alkaline. 4. Defense mechanism. The respiratory tract contains mucus, producing cells and cilia that help trap and remove airborne particles, microbes, and irritants to protect the lungs from infection. Common lung diseases. 1. Chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease that includes conditions such as chronic bronchitis and emphysema. It leads to restricted airflow, causing shortness of breath and coughing. Solution. Treatment involves smoking cessation, medication, pulmonary rehabilitation, and oxygen therapy in severe cases. 2. Asthma. Asthma is a chronic inflammatory disease that narrows the airways, leading to wheezing, coughing, and difficulty breathing, especially in response to triggers. Solution. Management includes avoiding triggers, using inhalers or other prescribed medications, and developing an asthma action plan. 3. Lung cancer. Lung cancer is the leading cause of cancer-related deaths worldwide. It can develop in various parts of the lungs and may not exhibit symptoms until advanced stages. Solution. Treatment options depend on the type and stage of cancer and may include surgery, chemotherapy, radiation therapy, or immunotherapy. 4. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs, causing symptoms like fever, cough, and difficulty breathing. Solution. Treatment involves antibiotics for bacterial pneumonia, rest fluids, and sometimes hospitalization for severe cases. Solution. Treatment involves antibiotics for bacterial pneumonia, rest, fluids, and sometimes hospitalization for severe cases. 5. Pulmonary fibrosis. Pulmonary fibrosis is a condition characterized by scarring of lung tissue, which makes it difficult for the lungs to expand and contract, leading to shortness of breath. Solution. Management includes medications to slow the progression of the disease, oxygen therapy, and lung transplant evaluation in severe cases. Promoting lung health. Maintaining lung health is essential for overall well-being and quality of life. Healthy lungs. 1. Ensure adequate oxygen supply. Proper lung function provides the body with sufficient oxygen for cellular respiration, energy production, and overall vitality. 2. Support physical activity. Efficient lung function allows individuals to engage in physical activities without undue shortness of breath. 3. Promote longevity. Protecting lung health is crucial for preventing and managing chronic lung diseases and other respiratory conditions. 4. Immune defense. Healthy lungs help protect the body from respiratory infections and pathogens. The lungs, the primary organs of the respiratory system, are indispensable for human survival. By adopting a lung-friendly lifestyle, such as avoiding smoking, maintaining a clean and pollution-free environment, and seeking medical attention when needed, we can ensure the continued well-being of our lungs, and, by extension, our overall health and longevity. Thank you for watching. Don't forget to like and subscribe to our channel for more content like this. Check out the description below for valuable information about the video, including some relevant links and resources.